Are you aware of the current HIV rates in the United States? This is a question that carries significant weight, especially in a country where HIV remains a prevalent health issue. Knowledge is power, and understanding the current HIV rates is a critical step towards combating this disease. The human immunodeficiency virus, or HIV, is a virus that attacks the body's immune system. If left untreated, it can lead to acquired immunodeficiency syndrome, better known as AIDS. In the United States, certain states bear a higher burden of this disease than others. Healthcare professionals, from doctors to public health workers, grapple with these numbers daily, aiming to reduce the rates through various strategies. But this isn't just a topic for the medical field. It's a conversation we should all be having because it affects us all, directly or indirectly. By understanding the current scenario, we can all contribute to the fight against HIV, whether it's through spreading awareness, advocating for policies, or supporting those affected. In this video, we'll uncover the top 5 states with the highest HIV rates. Stay tuned as we delve into this important discussion. First, we head to the Sunshine State, Florida. This vibrant southeastern state, known for its beaches and amusement parks, is also grappling with an issue of a different sort: a high rate of HIV diagnoses. In recent years, Florida has found itself among the states with the highest rates of HIV diagnoses in the United States. It's a troubling statistic that demands attention. But to fully grasp the gravity of the situation, we need to take a closer look at the numbers. According to the latest available data, Florida's HIV diagnosis rates have consistently been higher than the national average. But these figures are more than just numbers. They represent real people, mothers, fathers, sons, and daughters, whose lives are significantly impacted by this disease. So, what's driving these high rates? Well, a variety of factors are at play. Socioeconomic factors such as poverty and lack of access to quality healthcare are significant contributors. Furthermore, societal stigma and lack of education about HIV and its prevention methods can lead to higher transmission rates. Florida is also home to a large and diverse population, which can make it more challenging to implement effective prevention and treatment strategies. In addition, the state's tourism industry, which attracts millions of visitors each year, can also contribute to the spread of the virus. Yet, it's not all doom and gloom. Florida has made notable strides in fighting the HIV epidemic. The state has launched initiatives to increase HIV testing, improve access to care, and raise awareness about the disease. These efforts are crucial steps towards reversing the tide. However, there's still a long way to go. Addressing the HIV rates in Florida requires a continued concerted effort from all stakeholders, from healthcare providers and policymakers to community leaders and individuals. So, despite its sunny disposition, Florida faces a significant challenge with HIV. But with the right strategies and a commitment to change, there's hope that the Sunshine State can shine a light on a brighter, healthier future. Next, we travel to the West Coast, to California. California, known for its golden beaches and Hollywood glamour, carries a less glitzy statistic. It's one of the states with the highest rates of HIV diagnoses in the country. A combination of factors contributes to this, including the state's vast population, diverse demographics, and urban density. To put it into perspective, let's look at some numbers. Despite advancements in medical technology and preventative measures, the state still grapples with this health issue. It is crucial to understand that these figures may not represent the full scope of the problem, as not all infected individuals may be aware of their status or seek testing. The impact of the recent global pandemic has also affected access to HIV testing and case surveillance activities. Socioeconomic factors play a significant role in these rates. For example, homelessness, which is a pressing issue in California, is often linked to higher rates of HIV. Lack of stable housing can lead to increased risk behaviors and hinder access to healthcare services, including HIV testing and treatment. Substance use is another contributing factor. Drug use can impair judgment and lead to risky behavior, increasing the chance of HIV transmission. Additionally, sharing needles or syringes for drug use is a direct route of HIV transmission. The state's diverse population also plays a part. Certain communities, such as men who have sex with men and transgender women, have been disproportionately affected by HIV. Language barriers, cultural stigmas, and lack of access to healthcare can contribute to higher rates within these communities, but it's not all gloom and doom. California has been proactive in its approach to tackling this issue. The state has implemented various programs aimed at prevention, testing, and treatment of HIV. These include needle exchange programs, increased access to preventative medication like PrEP, and initiatives aimed at reducing stigma and discrimination. However, much more needs to be done to continue the downward trend of HIV rates in the state. The fight against HIV is a collective effort that requires the participation of all Californians, from healthcare professionals to educators, and everyone in between. California, with its vast population, faces a considerable task in managing and reducing HIV rates. Now, we find ourselves in the heart of the South Texas. As we delve into the Lone Star State, we're faced with a sobering reality. Texas is grappling with a significant HIV epidemic, with its rates among the highest in the United States. The statistics paint a stark picture. In the year 2020, Texas reported a high number of new HIV diagnoses, placing it among the top states in the country. But what drives these high rates? There's a complex interplay of factors at work. Socioeconomic status, lack of education, and limited access to healthcare services all contribute to the issue. In particular, rural areas and marginalized communities in Texas face substantial barriers to HIV testing and treatment, leading to late diagnosis and increased transmission. Another significant element is the stigma associated with HIV. It's an unfortunate reality that many people in Texas, and indeed across the globe, face discrimination and judgment due to their HIV status. This stigma can deter individuals from seeking testing and treatment, thus exacerbating the spread of the virus. Texas also hosts a large immigrant population, many of whom face unique challenges in accessing healthcare. Language barriers, fear of deportation, and lack of insurance are all hurdles that can impede access to HIV prevention and treatment services. However, it's important to remember that these statistics are not just numbers. Each data point represents a life affected by HIV, a person grappling with a diagnosis that can be life-changing. In response to this crisis, numerous organizations and initiatives are working tirelessly to combat the HIV epidemic in Texas. They provide invaluable services such as free testing, education programs, and support for those living with the disease. Yet, there's still a lot more to be done. In Texas, the battle against HIV continues to be a pressing issue. Moving on, we venture to the Peach State, Georgia. Georgia, known for its vibrant cities and southern charm, is unfortunately also recognized for its high rates of HIV. The state's HIV rates are among the highest in the United States, a fact that underlines the severity of the ongoing public health challenge. In recent years, HIV diagnoses in Georgia have been on the rise. This increase can be attributed to a myriad of factors. For instance, a lack of access to healthcare services, particularly in rural areas, contributes to the problem. Limited resources for HIV testing and prevention, as well as a lack of education about the virus, also play a role. In addition, social stigma surrounding HIV and AIDS can deter individuals from seeking testing or treatment. This is a significant barrier to addressing the issue, as early detection and treatment are key to managing the virus and preventing its spread. While the numbers may paint a bleak picture, it's crucial to remember that behind each statistic is a person. A person who is more than just a number. A person whose life has been impacted by this virus. A person who deserves access to the resources and support they need to live a healthy life. What's more, these numbers serve as a call to action. They highlight the urgent need for effective strategies to combat the virus. This includes increasing access to healthcare services, improving education about the virus, and reducing stigma. In Georgia, the high HIV rates remind us of the persistent challenge this virus presents. But they also remind us of the opportunity we have to make a difference. Through coordinated efforts and a commitment to public health, we can work towards a future where HIV is no longer a defining feature of the Peach State. Finally, we arrive in the Bayou State, Louisiana. This culturally rich state, known for its vibrant music, spicy cuisine, and Mardi Gras celebrations, is unfortunately also known for its high HIV rates. Louisiana, despite its small size, has one of the highest HIV rates in the United States. Let's delve into the numbers. The HIV diagnosis rate in Louisiana is alarmingly high, consistently ranking among the top 5 states in the nation. But why is this the case? There are several contributing factors to consider, and they are as diverse as the state itself. First, we must consider the role of socioeconomic factors. Many residents of Louisiana live in poverty, and this economic struggle often leads to limited access to healthcare services, including HIV prevention and treatment resources. Additionally, the state's rural geography can make it difficult for residents to reach healthcare facilities, especially those living in remote areas. Second, stigma and lack of education about HIV and AIDS play a significant role in the state's high rates. Misunderstandings and misconceptions about the disease can prevent individuals from seeking testing and treatment, leading to higher transmission rates. Lastly, the state's high rates of other sexually transmitted infections contribute to the spread of HIV. Louisiana has one of the highest rates of gonorrhea and chlamydia in the country, and these infections can increase the risk of acquiring or transmitting HIV. Despite being one of the smallest states in the U.S., Louisiana has one of the highest HIV rates. But this is not a hopeless situation. By addressing these contributing factors through increased funding for healthcare services, education, and reducing stigma, there is a potential to turn the tide and decrease the HIV rates in the state. The fight against HIV is a collective effort, and every step we take brings us closer to a healthier Louisiana and a healthier world. We've taken a journey through the top 5 states with the highest HIV rates. We've delved deep into the complexities of Florida, California, Texas, Georgia, and Louisiana, each with their unique challenges and circumstances. Yet despite these individual nuances, a common thread runs through them all: the pressing need for proactive measures to lower HIV rates. In Florida, we've seen how the state's diverse population and urban centers contribute to its high HIV rate. California's high rate is influenced by a combination of factors such as homelessness and drug use. Texas, with its large and diverse population, faces challenges related to lack of education and access to healthcare. In Georgia, poverty and lack of access to healthcare are significant contributors to the high HIV rates. And in Louisiana, a combination of poverty, drug use, and lack of education and healthcare access contribute to its position in the top 5. These complex challenges can seem daunting, but they're not insurmountable. There are a variety of proposed solutions that can help to lower HIV rates. One of the most crucial is increased awareness. Education is a powerful tool in the fight against HIV. By breaking down stigmas and misconceptions, we can encourage more people to get tested and seek treatment. Improved access to testing is another important step. Quick and reliable HIV tests should be readily available to everyone, regardless of their location or financial situation. Regular testing not only helps individuals to know their status, but also enables early detection, which significantly improves treatment outcomes. Advancements in treatment are also crucial. With the advent of antiretroviral therapy, HIV is no longer a death sentence, but a manageable chronic condition. Ensuring that these treatments are affordable and accessible to everyone is vital in reducing HIV rates. Lastly, addressing the underlying social determinants of health, such as poverty and lack of access to healthcare, is essential. By tackling these root causes, we can create an environment that supports good health and reduces the risk of HIV transmission. While the fight against HIV is ongoing, with awareness, action, and persistence, we can make a difference. Remember, knowledge is power, and together, we can work towards a healthier future.